All right, so hello everyone. Welcome to the webinar. Today we are going to be talking about sexual health, safe sex, and what these things mean during the COVID-19 pandemic. This is a topic that I think it can be really difficult to get good information about, so I'm really excited to be talking about it today. My name is Rachel May. I'm a Master's of Public Health student, and I have been working with the Wayne State Campus Health Center as part of my MPH practicum experience. So on the agenda today, we are first going to define safe sex. Then we'll talk more specifically about sexual health and some of the components of sexual health it's important to be aware of. We'll then talk about sex and dating in the context of COVID, and we'll think about some creative ways to stay engaged with your sexuality during COVID and how to evaluate risk when continuing to date during this time. Then we will talk about communication and stigma, and I will walk through some ways to make talking about disease transmission a little bit easier. So you may not be sure why I am talking about sexual health during a pandemic. First of all, sexual health is health, despite the fact that it is often ignored in routine health checkups. And we're all worried a lot about COVID right now, but it is also important to remember that health is so much more than just avoiding or safely recovering from COVID-19. It is important not to neglect other aspects of our health during this time. And that being said, sex, dating, and reproductive health can all have an impact, and sometimes a major impact, on our physical and emotional well-being. Additionally, learning about sexual health, and especially about things like contraception and consent, is not required in many schools. And so a lot of us end up entering adulthood with these major blind spots that make navigating this already difficult world of sex and dating even more difficult. College students are also just a demographic that is quite sexually active. Surveys have shown that most, upwards of 80%, of American college students have had casual sex or sex outside of a relationship. And hookups now are, of course, sometimes facilitated through new technology, such as dating apps like Hinge and Tinder. COVID has also certainly not stopped people from having sex. In the spring of 2020, when there were widespread lockdowns across the country, a survey was conducted that showed large numbers of young adults were breaking COVID quarantine restrictions to have sex. In Chicago, for example, over half of the survey participants reported having sex with someone outside of their household while the city was on lockdown. And along these same lines, abstinence-only approaches to sexual health education don't work. Just like how those results show that a government-mandated lockdown didn't deter thousands of people from hooking up, sexual health education that just tells people not to have sex doesn't prevent people from having sex, nor does it lead to less risky behavior. This is the same for abstinence-based HIV prevention, and we are seeing that this is the same for COVID prevention outside of a sexual context. The prevailing messaging in the US throughout the pandemic has been to avoid all social contact, which has led in many cases to pandemic fatigue. We are seeing that when people can't handle isolation any longer, but are not given any safe options for socializing, they end up participating in more risky behaviors, and that there is more secrecy around those behaviors. We'll be talking about all of this in more detail later, but here's the bottom line. The last thing I want to do in this presentation is just tell you not to have sex or not to have sex right now. That is not helpful. It's unrealistic, and it's much more important to me that you have a full toolkit and feel empowered to make choices where risk is assessed and understood. So, with all of that out of the way, what is safe sex? Basically, safe sex is preventing the spread of disease, and by this we mostly mean sexually transmitted infections. Safe sex is contraception or preventing pregnancy when you don't want to have a baby. It is consent or the mutual reversible agreement that participating parties want to have sex. And it is, at least for the time being, doing your part to prevent the spread of COVID-19. So, jumping right into it, sexually transmitted infections, or STIs, are what may more commonly be known as STDs. They are infections that are spread most commonly through vaginal, anal, or oral sex, and there are over 20 different infections known to be spread this way. STIs are really common. There are over 20 million STIs diagnosed in the US each year, and half of these occurred among Americans in the 15 to 24-year age group. Half of all sexually active people will get an STI by age 25. And just like COVID, many people with STIs are asymptomatic and don't know that they're infected. Many STIs are treatable, some are not, and many of them can cause potentially serious health consequences if left untreated. We'll talk more about what to do if you learn that you get an STI or if you struggle disclosing that you have an incurable STI later in the presentation. So we, of course, want to prevent the spread of sexually transmitted infections. One of the best ways to do this is to use condoms, especially when you have a new partner or if you have multiple partners. There are also other effective barrier methods available that are a lot less well known than condoms. Internal condoms are very similar to condoms that are worn on the penis, but instead are placed inside of the vagina or anal cavity. Note that if you do use an internal condom, that's all that you need. Don't also use a standard condom. Doubling up actually puts you at risk for both condoms breaking. Dental dams are a third type of barrier method where a latex square is placed over the vagina or anus before oral sex. Condoms work best if they are put on before sex has started and if they've been kept somewhere away from friction and out of extreme temperatures. Vaccinations are available for protection against hepatitis B and human papillomavirus, or HPV. You may have gotten one or both of these vaccinations as a child or an adolescent. If you are not sure, you may need to check with your doctor or potentially the doctor you went to as a child in the case that your vaccination records have not been transferred. If you have not gotten the HPV vaccine, the age range for the vaccine was somewhat recently expanded to up to 45 years of age. So if you haven't gotten vaccinated because you thought that you had aged out, I would recommend looking into it. PrEP and PEP are medications you may have heard of that protect against HIV. PrEP stands for pre-exposure prophylaxis. It's a pill that, when taken daily, greatly reduces your chances of contracting HIV. And PEP, or post-exposure prophylaxis, is an emergency medication taken for about a month and started as quickly as possible after a potential exposure to HIV. And here are some good general guidelines for when to get tested for STIs. If you are sexually active and are experiencing new symptoms, it is definitely a good idea to get tested. Be aware that depending on the results and the timing of your past sexual experiences, you may be advised to return for follow-up testing, since the timeline for when each STI is able to show up on a test differs. If you have been sexually active in the last year but have not been dating multiple people, it is good protocol to still get tested about once a year, such as at your yearly physical. If you are going on multiple dates or are in an open relationship and are using a barrier method every time, you should aim to get tested as frequently as every 3 to 6 months based on your existing health status. Talk to your doctor and be honest about your behavior to help determine a schedule that works best for you. And then, if you're in a situation where you're getting serious with someone and are thinking about ditching condoms, both of you should definitely get tested before proceeding. I want to add here that, like I mentioned before, there is this idea right now that health only means protecting yourself from COVID-19, which has led to people neglecting to seek healthcare for non-COVID related issues. This, unfortunately, means that there was a big decline in the number of people who got tested for STIs in the previous year, which means it will be even better to be more proactive about your own testing as you navigate dating right now. And then finally, communication is very important when you're sexually active, and especially when making a decision to stop using condoms. It might be tempting to trust that your partner is STI free because you like them a lot and feel a level of trust growing between the two of you, but getting tested is the only way to know for sure. Moving on, contraception or pregnancy prevention is another major component of safe sex. Here you will see listed are all of the different methods of contraception. When used appropriately, both prescription birth control methods and condoms are over 95% effective at preventing pregnancy. Each method of birth control has different pros and cons depending on your needs and lifestyle. IUDs and implants are LARCs, or long-term reversible contraception. They are inserted and stay effective without maintenance for years at a time. The birth control shot, NuvaRing, and the patch are neither LARCs nor are they daily method. Each dose of the shot lasts for 3 months. NuvaRing is worn for 3 to 5 weeks at a time and then is swapped out for a new ring. And the patch is worn for 1 week at a time and then changed for a new patch. The birth control pill is taken every day, and using condoms and diaphragms or pulling out are methods that have to be remembered every time that you have sex. And do note that the pull-out method is only about 78% effective when used alone, and emergency contraception, which you'll see at the bottom there, should only be used in emergency situations and is not a replacement for regular birth control. So unfortunately, I don't have more time to get into further details about these methods right now. So I want to direct you to Planned Parenthood's website and to bedsider.org, both of which have very detailed but super easy to understand information about every type of birth control method. I found these resources extremely helpful in my own experiences, since you often have a limited amount of time to talk to your healthcare provider at an appointment. They can't always sit down and explore every option with you. So it's great to first read about what methods might best suit your lifestyle, narrow down your options a bit, and then bring any questions to your appointment. I also want to add here that condoms can be used with any other type of birth control to make the chances of becoming pregnant even lower, and of course, help prevent the spread of STIs. And finally, I want to add that Planned Parenthood, or the idea of avoiding pregnancy when you do not want to have a baby and feeling supported when you do want to grow your family, definitely does not only apply to cisgendered or heterosexual people. Unfortunately, not every healthcare provider yet understands this, and that has affected the way some LGBT patients are treated. glma.org and outcarehealth.org are two databases that can direct LGBT patients to providers that affirm their gender and sexual identities. Consent is something that is being talked about a lot more in recent years, which is great, but it is still often left out of conversations about safe sex, and it is important to me to address it here. I like this mnemonic of Fry's from Planned Parenthood, which helps break down what exactly consent is. So just going down this graphic right here, consent is freely given, meaning both parties agree to sex without pressure or being influenced by drugs or alcohol. It is reversible, and anyone can change their mind at any time, even if you have already had sex with someone or if you have started hooking up. That does not mean you must continue. Informed means you are consenting to the information you are given. For example, if you consent to have sex with someone if they use a condom and they then remove the condom, they're violating your consent. Enthusiasm is pretty similar to freely given. It just means that someone should not feel they have to agree to sex if they do not want to have it. And specific means that if someone consents to one thing, it does not mean they are consenting to everything. For example, if someone consents to take their top off, that is not consent to have sex. I want to stress that if you go on a date and are on birth control or bring condoms with you, it does not mean that you have to have sex. Being responsible is not the same thing as consent. If you have been or find yourself in a situation where something happens that you did not consent to, please consider reaching out to any of these resources. SASHA is a local organization that provides sexual assault services, prevention, and recovery from an African American perspective. Avalon Healing Center and Equality Michigan are also local agencies. RAIN is a well-connected national organization with a 24-hour helpline. And then I put the contact information for the University Ombuds here. They're a campus resource that can be a great alternative if you want to confidentially discuss something that happened on campus or with another student, but are unsure whether or not you want to go to the police with that information. And now, the elephant in the room. We're going to talk about love in the time of COVID-19. So before we get into it, I just want to take a second and look at these web pages from other parts of the world. On the left, we have a government website from the UK that is a how-to guide for safely expanding your bubble of social contacts outside of your household. And on the right, we have a real headline referencing how the Dutch government literally advised citizens to find a sex buddy because, quote, it makes sense that as a single person, you also want to have physical contact during this time. That is not the message that we're getting in the US. The CDC continues to prioritize an abstinence-only approach to socializing during COVID, even for people who are vaccinated. They preface almost every article about anything COVID related with a statement about staying home. The reality, though, is that this all or nothing approach doesn't capture the fact that there is not one way to socialize. There are many ways, and each has an associated level of risk. And we are going to walk through the different tiers of what is possible right now. So level 1 will be social distancing. And before I even get into it, I want to acknowledge that the emphasis on social distancing is not even realistic for many of us anymore who have had to go back to work and to other in-person obligations. But in the context of this spectrum of risk evaluation, the idea does still apply. Starting at the bottom with no risk of disease transmission is going to be solo play or masturbation and phone or video sex, although I know we're all sick of Zoom. I do want to shout out Spectrum Boutique, which is a sex toy store based in Detroit. It is sex positive and LGBT affirming. And while they sell plenty of toys which can be used to explore solo or distanced sexuality in new and creative ways, they also sell books on sexual health, reproductive health products like menstrual cups and condoms, and products that help support gender identity and expression. Moving up, the next level of risk will be once a partner becomes involved in person. The lowest risk here will be having sex with a monogamous partner or with someone in your household. There is now a chance of transmission, but it is likely that this risk is already worked into your daily assessment of risk if you are already spending a lot of time together in close proximity without masks. That being said, since we are not out of the woods yet with COVID, be attentive to your health and mindful of how you are feeling. If you or your partner feels sick, it is best to hold off on having sex until fully recovered. Level 2 will be distance dating. This is if you are looking to date, maybe with the intention of a monogamous relationship, or if you felt inspired by that Dutch sex buddy system, and you want to be as safe as possible while meeting new people. Having dates outdoors, keeping physical distance, and wearing masks the entire time makes spending time with somebody new or outside of your household much safer. Although I know it has been really cold, especially this week, and outdoor dates might not feel really realistic right now, I just want to say I added this picture because it looked cold, but also really safe and really romantic. And if you're serious about reducing risk, but are looking to have an in-person sexual experience with someone new, masked mutual masturbation while at least 6 feet apart is the safest way to proceed. If you are going on distance dates with someone, hitting it off, and want to go further, it might be a good idea at that time to have a conversation about transitioning to a monogamous relationship, whether that is indefinite or just until the situation with COVID is safer. And then level 3 is for anyone who heard me say distance mutual masturbation and thought I was crazy. I'm making a joke, but actually, for some people, everything I just said may have sounded totally unrealistic. So, if you are actively dating and hooking up during this time, you can still reduce the risk of COVID by doing things like wearing masks the entire time you are together, especially indoors, and when having sex, sticking to positions where you are not face to face. After a hookup, you can help keep others safe by isolating as much as possible for the next 14 days. So avoid hanging out with friends or going on other dates or hookups during that window. Keeping track of who you are seeing and who your close contacts are is also going to be really important. In the event that you or someone in your circle gets COVID, it will be important to move forward with that information responsibly, which I will talk more about in a moment. Bottom line, there are real health benefits to socializing, intimacy, and touch. It makes a lot of sense that when weighing the risks and benefits, many have opted to accept the risk of getting COVID in order to meet these real needs, especially in this time that feels so isolated. So, if you are dating in person right now or are considering it, I recommend just keeping in touch with yourself through all of this. Evaluate your bubble. If you're planning on seeing an elderly family member soon, try to be extra cautious in the time leading up to that. If you have a housemate with a chronic illness, avoid bringing new partners into your home. Also, everything I talked about earlier related to consent also applies here. You should be able to change your mind if you start to feel uncomfortable with something, and you should be able to set specific boundaries about what you do and do not want to participate in right now. And you need to respect someone else's feelings and decisions about these things too. Remember that you are ultimately responsible for the decisions that you make right now. If there are unwanted consequences to a decision that you make, that does not mean you deserve to be punished, but it does mean that you need to move forward and accept the reality of the situation and handle it appropriately. Safe sex requires communication. This includes communication about STIs, boundaries, about whether or not to be monogamous, about how you are approaching contraception, etc. If you're having new symptoms and believe that you may have an STI or COVID-19, get tested. And if the results of that test come back positive, make sure that you follow the entire treatment your doctor prescribes. Tell your partner or partners that may be affected by these test results. More information on how to do that in a minute. And if it's COVID, make sure you also tell any housemates, your employer, as well as any contacts from your local health department that reach out to you. Also, if you learn that a sexual partner has tested positive for COVID-19, you must quarantine yourself, even if you are not having symptoms. Telling the appropriate people about a positive test result can be really difficult and scary, especially because there's so much stigma around these things. I really hope most healthcare professionals strongly believe in withholding judgment in situations when someone gets sick, but stigma and fear have led others to be much more harsh and judgmental about these things, especially in a time like now, which can feel really hopeless and out of control. Engaging in things like COVID shaming can feel cathartic and even kind of just and necessary. But the reality is that this type of shaming often leads to secrecy from people who get sick, which can lead to even more people getting infected without knowing it, and then makes tracing transmission in efforts to curb the spread extremely difficult. In the case of STIs, it is especially important to tell anyone you slept with that you may have either gotten the infection from or given the infection to, as they may need to get treatment themselves and stop that chain of transmission. If you have an incurable STI and have a new partner, telling them helps you both make informed decisions about how to keep them and any potential future partners either of you may have safe. Telling your partner about a positive test result can be really stressful, but being intentional about how you approach this can help make the process easier. Step one will be to get the facts about your diagnosis. Whether this is information you get from your doctor at the time of your diagnosis or information that you get from an internet resource. I linked Planned Parenthood here again because they have really great info on STIs, but they also have a really comprehensive fact sheet about COVID. Educating yourself means that not only are you ensuring you're not spreading misinformation, but you will likely feel more confident if you can answer questions that will probably come up when you tell your partner, such as, what do we do now? Making a plan for how, when, and where you are going to talk can also help you feel more confident and not leave the task hanging over your head. For example, you may want to ensure the two of you are in a private place so you're not worried about others overhearing, or if you are afraid the person you are telling may have a bad reaction, scheduling a phone call might be a better idea. It also might be a good idea to ask a friend that you trust to be available after the time you have planned to talk to your partner so that your friend can check in and be of support to you if you need that. Once you are actually telling your partner, it is important to be direct and to do your best to stay calm. A good way to begin the conversation is to assure your partner that you care about them or that you want to protect their health. You may feel angry or even blame them for your diagnosis, but it is more important that you first get the correct information across to them. And if they do not react kindly in turn, it is okay if you do not feel able or comfortable to console them. And it is okay if you do not want to continue seeing this person any longer. And then finally, be proud of yourself. You did something really challenging and you played an important role in keeping others safe. So that brings us to the end of all of the information that I have for us today. Thank you so much for your time. I know we went over a lot here, so I want to direct you to the Campus Health Center if you have questions or want to speak to a health professional about any of these topics. Thank you again, and thank you to Karen and Erica who supported me in making this presentation for you all. And I hope that you have a safe and happy Valentine's Day.